Good morning, everyone, and thank you for joining us today. We're still waiting for a few more folks to join. However, we're going to go ahead and get started. I am Patricia Cherstiniak, and I'm going to just walk us through some housekeeping and introductions and to get us settled in for today. Again, it is Thursday, February 18th, and thank you so much for joining us, whether it is live or whether if you're watching this live or recorded. I am going to stop my video, even I'm here, only because I have quite a few screens up and it helps with my concentration. We will feature a few highlights about Lake County. And if you are joining us from any other county in the area, please know all of the information we have for Lake County is also available for your area. Next slide, please. We are using WebEx and encourage you to enter your questions and comments in the chat box. If you're on a PC, it is likely located in the bottom right-hand corner of your screen. We will monitor the chat as we go. We will attempt to weave your questions into the discussion and definitely address them at the end. We encourage you to view the screen at full size for better optimization. Next slide, please. Again, I am Patricia Cherstiniak, and I work at the Center for Health Affairs. The center is a hospital membership association serving 36 hospitals in 9 counties. We set ourselves to be a convener, influencer, and innovator that impacts health in the communities where we serve. Next to me, we have Sarah Szabo and Libby McGraw. Sarah and Libby, could you introduce yourselves now?
Sure. Good morning, everybody. My name is Libby McGraw, and I am the Regional Community Health Improvement Manager with Healthy Northeast Ohio, and I also work at the Center for Health Affairs along with Patricia.
Good morning, everyone. My name is Sarah Szabo, and I am a data analyst at the Cuyahoga County Board of Health. I also serve as the data analyst for the Healthy Northeast Ohio project, and I'm one of the local site administrators for the website.
Thank you. And I'm also a local site administrator. My role has changed, I guess about 6 months ago, give or take. However, it is the 3 of us that bring all of this work together. So if you're ever on the website and if you have a question and go to that contact us, it goes to all of us and we work very closely together. Next slide, please. I'm going to give us an overview of our time together. Libby will kick us off with a website overview, and Sarah would take us through a deeper dive into some of the data and website functionality. We will turn back to Libby for resources and other features. Please note, some areas will be a very quick show and tell, and others will be a more thorough walkthrough. Again, time is set at the end to address your questions, in case there is something of interest that maybe we did not spend enough time on. Next slide, please. So Healthy Northeast Ohio is a website in partnership, and our main goal is that we want you to use health data for your decision making, whether if it's at the program level, agency level, strategic planning, what have you. There are 4 learning objectives for you today, and I will give you a moment to read these over. Next slide. We launched our website on December 5th of 2019. And as you know, 2020 provided quite a year of adjustments and pivots and all of that. So you will see we have slightly over 5,000 users to date. At the end of this session, tell your friends and we can see that number grow. We are currently working in 7 counties, with Lake and Summit being the latest 2, in addition to Ashtabula, Cuyahoga, Lorain, Medina, and Portage counties. Ashland and Geauga will round out the region, and those 9 counties make up the same region as the Center for Health Affairs. This work is supported by a grant from the HealthCount Foundation, and then we also have contributions and support from hospitals and our local public health departments. We are extremely grateful for everyone who makes all of this possible. So that kind of concludes my obligations and requirements. We're going to break the ice with a quick poll. So Libby, if you can open up that poll, and we want to know, have you used Healthy Northeast Ohio prior to today? Maybe you're a power user, maybe only a little bit, maybe you've seen others use it, or you have never used or seen it. And go ahead, submit your answers, and then Libby will close us out and close out the poll and share what we have with us today.
Thank you, Patricia. And thank you, everyone. We see these answers come rolling in, so we will give you another moment or two to make your selection, and then we will share those results out with the group. Okay, great. We are going to go ahead and close the poll. And you should start to see those poll results populating on your own device at home, so or wherever you are. And so we see that we have quite a nice variety of answers. We have some of you who have used it, but only a little. We have some of you who have never used or seen our platform. And all of those are great answers, because that's great for us to know. If you have visited us before, welcome back. We're very pleased to have you here with us again. And if you have never been with us, welcome for the first time. And we hope that everybody who's on the call today is able to walk away with a little bit more information on how this platform might inform your own work. So we are going to go ahead and start our live demonstration. So I'm going to go ahead and switch over to our website. So bear with me as I do that. Okay, great. So at this point, you should be seeing our homepage, and I'm going to be providing just a high-level overview of what this homepage has to offer. And we're also going to explore some of our key pages that we have available to you that'll make some of your first use, or if you are revisiting, it should make your navigation of our website a little bit easier. So here on our homepage, our navigation menu at the top will be one of your best friends as you navigate through our website. This is how you will be able to access many of our different pages. At any point when you're navigating our website, if you would like to return to the home page, you can click our logo and it will bring you back home. Right now, as many other health-oriented websites are, we are featuring COVID-19 updates and information. So you will see that right at the top of our webpage at this time. We also have a link available to view all of our data. If you have a specific data topic or keyword, maybe an indicator you're looking for, you can quickly access that through our search bar. We have access to our 7 county pages through these raspberry colored buttons, and we will revisit that in just a moment. We also have a what's new section. So typically here we will put updated information, maybe a new index such as this food insecurity index, which was just made available on our site. We are highlighting monthly data indicators in our different regions. So you can see for this month, we are highlighting heart health, and we are focusing on that one of those indicators available in Lake County. And then lastly, at the very bottom of our homepage, you will see a scrolling list of all of our different partners who we are so fortunate to work with. At any point, if you are interested in visiting any of those partners' websites, you can click on their logo and it will take you directly to their webpage. One of the next slides, or one of the next pages I'm going to go ahead and show you, is our Lake County specific page, since we are featuring this webinar for our new partners in Lake County. And another way you can access these pages is through the Explore by County dropdown. And you would just click on whatever county you're looking for. And here you'll find that we have some nice overview information about Lake County's population, some geographical information. We also have a couple links to the county health rankings so that you can see where Lake County ranks among other Ohio counties. And then as you continue on through this page is where you will start to be able to access some of our different data indicators that we have available in Lake County. We are pleased to feature a direct link to Motivate Lake County because we understand and realize how important it is and how valuable their efforts are for improving the community health in Lake County. And in this second row, you will find some different handouts. You'll find some different reports for the health assessments, community health needs assessments, improvement plans, and implementation strategies. And these come from our partners at the health department, at the hospital system, and we know that these are important documents for informing whatever those health priorities are in Lake County. So that's a little bit about what's available on the Lake County page. One of the next pages I'm going to specifically show you is the demographics page. Now, this is one of our most popular pages for our site visitors. This is one of our many dashboards that will be available to you on Healthy Northeast Ohio. Here in the dropdown, you can switch the location that you're viewing, but since we are focusing on Lake County, we're going to keep it there. We also have some other information down here, and you can see that we have it laid out in different ways. That's the nice feature about the vendor who we use, Conduit Healthy Communities Institute. They have data kind of laid out in different formats, and it makes it quite interactive for our visitors. If you would rather see a listing of all of our demographic information, you could click on this button up here on the right that says View All Demographic Variables, and it will take you to a listing view of everything that is available to you there. I'm going to scroll down to the very bottom of our page, and this is our topic center that you see here. So at the top of the footer, we have different icons, and this will take you to our topic center. So the first one I'm going to click on as an example is going to be our social environment. And this is a great way to bring related content to one place. So especially if you're a new user, if you're just getting started on our website, this is a great way to quickly find related information. As we clicked on social environment, it populated with many different indicators related to social environment that are available on the website. We also have different resources that have populated when we clicked on that, funding opportunities, etc. So this is a really great way to visit some of those topics very quickly. You can click around on the other icons as well if you're interested in looking at any of those topics. And you can also use our drop down here to view any of the other subtopics that we have available. Lastly, to round out our footer that we have features available to you through, we do have a help button, which you could use if you have to search something on our site. And we also have an FAQ page, which is very helpful to our site visitors, especially if you have a quick question that you kind of want immediate answers for. And this is maintained again by our vendor, Conduit Healthy Communities Institute, but there are some great common questions in here, again, for just those quick answers. Specifically, one of the questions that we get pretty frequently is how to cite data available on our site. So if you click on this, you can find out more information about that. Or perhaps you are looking at an indicator and you're unsure about what an age-adjusted rate is, you can perhaps look at the definition for that as well. So that is a little bit about our website, some of those key features. And to round us out with the next section of our webinar training this morning, I'm going to invite Sarah Sabo, who is our data analyst, to talk about all things data.
Thank you, Libby. Bear with me just one moment while I share my screen. Libby, can you confirm, are you seeing the website?
I am, Sarah, thanks.
Perfect, perfect, thank you. Again, good morning, everyone. Thanks so much for joining us, and thanks, Libby. So as Patricia and Libby shared, in this next portion of our webinar today, I'm going to be mainly focusing on the Explore Data tab. And just to reiterate what Patricia, shared, we know firsthand how time-consuming it can be if you have to pull data from multiple places, and even if that data is publicly available. So again, just to reiterate that the Healthy Northeast Ohio site, centralizes a lot of this population health data, and we do have some nice tools to help you create some custom data visualizations on the site. So the first thing that I'm going to do is I'm going to show you how you can search for data on the site, and just keep in mind that there's a couple ways to do this. But the first thing I want to show is the Explore Data tab and the indicator list by location. I think this is very useful, especially for the new users to the site, just to kind of get an orientation of what type of data we have available. But as you use the site, if you're doing searches by a specific location and you're not coming up with results, it might be a good idea to come back to this list, which lists every indicator we have available on the site, as well as the geographic levels that those indicators are available. So right now we have about 225 indicators coming from more than 30 sources. So those are mainly national and state, but we also have some other sources as well. And also keep in mind that the availability of data on the site just depends on the source that the data is coming from. So you can see this list. I won't scroll all the way down because it's very long, but all of these indicators are organized by topic and then by subtopic. And then again, to the right, you can see at what geographies these indicators are available. We do have data available for the 7 counties that Patricia shared, as well as the municipalities, zip codes, and census tracts that make up those counties. And if you want, you can download and save this list just by clicking here, download a list of indicators on the site. But again, this is just a good starting place, and you can click on an indicator name if you want to go to that specific indicator to get more information. So that's the indicator list by location. Another way to search for data on the site is going to explore data, then search for data. So on this screen, you can do a keyword search. You can search using this find an indicator dropdown, as well as searching by a specific location. So for the sake of example, I'm just going to do a keyword search, and I'm going to go ahead and do that for blood pressure, because I know that chronic disease was a priority area in the Lake County CHIP. So now that I did my keyword search, you're going to see a list of all of the indicators that are related to blood pressure show up. So I'll just scroll a little bit just so you can see those. So if you see an indicator of interest and you want to take a deeper dive, all you have to do is click on that indicator. So say, for example, I'm interested in hypertension in the Medicare population. I would just click on that indicator name. And now the site is going to prompt you to select a location. So if you're interested in a specific location, you can just use this drop down. And I'm going to go ahead and select Lake County. So now you're taken to what's called the indicator detail page. So this is where you can read all of the specifics about the indicator. So up top, you're going to see a description of what this indicator is, as well as some language about why this indicator is important. You'll see the current value for the location you selected. So for Lake County, the current percent is 58.6%. You'll see the source of the data, the measurement period, and then even when this indicator was last updated. And then to the right, you're going to see that the site does use a lot of gauges, styles, colors, which might look a little overwhelming at first glance. But over here are just any comparisons that are available for this indicator. So for example, if you hover over an indicator, some text will pop up just to help you interpret that. So it looks like the Lake County value is higher and worse than the US value. And I'll just scroll down just a little bit. And then over on the left, you'll also see in blue where it says see the legend. You can click on that to expand it, and you'll get a quick breakdown of the colors that are used on the website, as well as those gauges and dials. So that's always there if you need it. And you can just click hide the legend, and that'll minimize. So next, you're going to see this change over time graph for this indicator. And do keep in mind that all of the charts, the maps, all of that on the website are downloadable just by clicking this 3-bar symbol, and you can download those. And then if any subgroup data was available for the indicator, you would see that listed here. So it looks like for this indicator, they're breaking it out by age group. And then I'll just scroll down a little further, and now you're going to see a map. Again, these maps can be downloaded. They're interactive, so I could zoom out, for example. So this is just showing a ranking of the 7 counties that we have available on the site for this indicator. I could add labels, you can change the background map, etc. And then again, here's a bar graph showing the different values for this indicator for our 7 counties with Lake County highlighted. And then just below that, there's also going to be a table of this data available for you. And you can download data just by clicking download county indicator, and you can download that to a CSV file. And then Libby did share the topic center, but I thought I would also just point out at the bottom of the indicator detail page, this is another spot where the website does bring together related content. So that's a nice feature. So that is the indicator detail page. So that's 2 ways that you can search for data on the site. So in addition to all of the indicators on the site, we also have various specialty dashboards available to you. And a dashboard is just a collection of indicators, and that could be around a topic of interest or a specific location. So I'm not going to show you the demographics dashboard because Libby already covered that. But again, just to reiterate that we have 250 demographic variables available, and those are available at the state, county, and also zip code levels. We also have a disparities dashboard. So if you're interested in looking at differences, between groups, you could use this dashboard to identify those groups, to focus your program and our policy efforts towards. And basically this dashboard allows you to view any indicators that have subgroup data that's available, and it's by race, ethnicity, age, and gender. And again, the availability of this data just depends on the data source. And you can use the drop-down menu to select the specific location that you're interested in. Another specialty dashboard is the Food Insecurity Index. And as Libby pointed out, we have this highlighted in our What's New section on the homepage, but we're excited to share this new tool with you. It's literally brand new. And this is a tool that was created by our vendor, Conduent HCI. And it's a measure of food accessibility that's calculated using social and economic factors like household expenditures that might impact a household's ability to purchase food. So this index can be used to identify areas in your community that are estimated to have the highest food insecurity. And in a nutshell, basically how this works is that all census tracts, zip codes, and counties are given a national index value, and those range from 0 to 100, with 100 being high need. Then those index values for each location in a community are ranked from 1 to 5, with 1 indicating high need. So here is the Food Insecurity Index map. And as you can see, the darker the green shade in the map, the higher the estimated food insecurity. And the nice thing about this tool is that right now, the default is set at showing us all of the zip codes in our 7-county region. But if you want to kind of focus in your efforts to a particular county, you could use these drop downs right below this map. So I'm just going to go ahead and do View Level County, narrow your search Lake County, and then you could either select zip codes or census tracts, so I could zoom in a little bit. And then again, this map can be saved. And then just below this map, there's also going to be a bar graph. So this right now, because I have that data filtered, is showing the values for all of the census tracts within Lake County. And it's always striking just to see, the vast range of need that can exist within one community. So we've got here a value of 6.8, and then we also have a value of 95.5. And then just below that, again, because I filtered those results, we're just seeing the values and ranks for the census tracts in Lake County. And again, you can download this data just above that table by clicking CSV. Scroll back up. Another specialty dashboard I wanted to show is our Socio Needs Index. So this is another tool that was created by Conduent HCI, and this summarizes multiple socioeconomic indicators like poverty and education into one score for easier identification of under-resourced areas. And again, this is available at the county, census tract, and zip code level. The methodology is similar in that it uses that same values ranking from 0 to 100, our index values from 0 to 100, and ranks from 1 to 5. But I just wanted to show you this. And there's a map that you can also filter like I did for the Food Insecurity Index. And then the last specialty dashboard is the Healthy People 2030 Progress Tracker. So this progress tracker shows how a location compares to the National Healthy People 2030 10-year objectives for improving health. So again, you can select a location you're interested in, and there's just 2 icons that are used in this dashboard. So you're either going to see this red X or a green check indicating if a target is being met currently. And you will see we still have the Healthy People 2020 targets, as the Healthy People 2030 just became available later last year. So we still have both of those here. So that covers all of the specialty dashboards on the site. We hope your next visit to the site, you can check those out in further detail. And then the next thing I wanted to do is to show you, again, within the Explore Data tab, is how to build a customized dashboard. So I'm just going to click on my other tab here. Excuse me. So again, a dashboard is a collection of indicators, and this is a way that you can visually represent data that you're interested on the site. So this dashboard is going to show a summary of the indicators you included, as well as whatever comparisons might be available. So, you know, for example, comparisons to other counties in the state or the US, maybe national benchmarks. And just, I want to point out that these custom dashboards are dynamic. So as new data becomes available for these indicators, your dashboard will automatically update, which is really nice. And this tool can be used to help you, you know, if you're writing a report, if you want to pop one of these visuals into a PowerPoint slide, you know, publications, or maybe even a grant application. And you can embed a link to the custom dashboard you create and put that into a document, or maybe even post it on a website. So I'm going to start just by showing you a custom dashboard that I created, and then I'll kind of walk you through the steps of how to create one on your own. So I did see that mental health and addiction is another priority area in the Lake County CHIP. So given that, I created a custom dashboard that includes a few mental health and addiction related indicators. So you can see for this dashboard, I selected my location as Lake County. And I have, I'll scroll, I think I've got just a couple more indicators here. I've got a handful of indicators that I included. In this column here, you're going to see the value for the location you selected. And then again, to the right, you're going to see the various comparisons that are available. So again, it's, you know, it looks like age-adjusted death rate due to suicide is currently not meeting the Healthy People targets. If I scroll down, adults who drink excessively, it looks like that target is being met for Lake County. So again, this is a dashboard that you can create, selecting whatever location and indicators you're interested in. And I'm just going to scroll up and kind of talk you through how I created this custom dashboard. So there's two ways that you can create a custom dashboard. One is using the handpick indicator option, which is what I've done here. That's best if you have specific indicators in mind you want to include, but there's also a filter indicators option, which is more suited if you want to filter by a topic area. So again, I use the handpick indicators option. In this first field here, this is where you're going to select the indicators that you want to include. So you can see here, those are my indicators. The second field is where you would select your location. So I selected Lake County. I will point out just a quick tip to the right. There's this downward facing arrow here. And say, for example, you were interested in looking at all the zip codes in Lake County. This is a time saver. So you could just click Lake zip codes and they would all populate here rather than having to select them one by one. And then you would make whatever other selections as far as filters go that you're interested in and just click search. And then your custom dashboard will be shown. And I did want to point out that custom dashboards can be viewed in one of two ways. So they can be viewed in the list view, which is what you're seeing now, which is basically like a row per indicator. But there's also an option to view them in card view. So again, below search results, you'll see this like box icon. If you click that, you're going to see your dashboard in the card view. And these cards are really nice because you can save them individually. And for example, again, you could, you know, if you're working on a presentation, you could pop that into, you know, a slide very easily. And then the last thing I wanted to show is just how you can save a link to your custom dashboard. So again, below search results, if you click save a link to this search, you can copy this URL and you can, you know, send it in an email, embed it in a document, etc. There. So that is how to create a custom dashboard on the site. We hope that this tool will be useful to you. So I'm going to go ahead and turn things back over to Libby, and she's going to cover some of the other tools and resources on the site.
Thank you, Sarah. That was a great overview. We did have a question come in that I did want to address with the group. The question was, can anyone use this information and access this website, or do you need specific login information? This is open to everyone, so we certainly invite you to share that with people in your network, people that you work with. And another comment we received was that there is a lot of information available on here, which is great. It is very broad reaching. As you likely saw through Sarah's demonstration, the different levels of indicators that we have available really makes for a nice repository of a great deal of population health data. So thank you for those comments and questions. We are going to go ahead and open our second poll, and this question is going to specifically ask about secondary data. So that poll is now open. Take a few moments to go ahead and answer that. And as you are looking through those options to select your answer, I'm going to go ahead and share my screen again with our website for the next section. We'll leave that open for another moment. Okay, we are going to go ahead and close out that poll, and we are going to review those results. And it looks like, again, we had a nice variety. How often do you use secondary data? Some of you said all the time. Some of you said only a few times a year or only when needed. And we did receive some no answers, but that's great. All those answers are great for us to hear. Again, it is wonderful to see the great variety, and we hope that this information that you're receiving today makes that secondary data more accessible, and hopefully you're finding new ways that maybe you could utilize secondary data in your day-to-day work. So I'm going to go ahead and start our next section of the training. And we are going to specifically talk about some key tools and resources that are available on our website. So the first one that I'm going to point out under tools and resources is our Promising Practices feature. I do have a background in public health education specifically, so this is a feature that I really appreciate. I think anybody who works in that programmatic space will find a great appreciation for this. And this is a database that is available to us through our vendor Conduent, and it has a great deal of information and different types of practices. You can read a little bit more here under the ranking methodology. But in short, there is essentially access to evidence-based practices, effective practices, and good ideas as they have identified them. So you can read more about that here. One of the invitations that we would like to extend to all of you and to all of the partners in our region is to please consider submitting a promising practice. If you do have something specific that you are working on in a program that has been really effective, we invite you to submit that. Again, that will go to our vendor Conduent. However, we would love to see some of those great programs that we know are happening in Northeast Ohio featured in this database. And these will be accessible to people across the nation who utilize the same database and platform. So we are going to walk through one brief example just to give you a little bit of a deeper understanding on how to use this specific page. As you see over here under the filter area, we have a lot of different programs that are available through here. So we would definitely want to narrow that down if we are looking for information about a specific program. So for our example today, I'm going to select diabetes because we know that that was a priority for Lake County in their CHIP. And you can select what type of program you're looking for, again, based on their ranking. I'm going to go ahead and select evidence-based practice. You can also make some deeper selections to target, to narrow down that search result as well. So I'm going to select the target audience of adults. And you can also select some topics, subtopics, geographic type. I'm going to go ahead and leave those blank for now, and let's see what those results populate for us. And we can see that that really narrowed down those results to 19 from, I think, what was originally about 2,300. So still quite a few, still might take a little bit of time to filter through all those. So immediately you might want to save the link to that search, or if you have maybe somebody you're working with or who works for you, you can always send that to them for review as well. So I'm going to showcase this first one that we see come up. And this is a diabetes self-management program. You can see in the top here how that methodology was utilized and how that met our vendor Conduent's criteria for being an evidence-based practice. We have a great description. You'll see that we start to see some more information about the results of this program. You'll also start to see some information about who and what entity submitted that practice. So especially if you are just starting out and looking at some information where you're trying to start recruit information about how to implement a program such as this, that's a great area to start exploring, especially if you want to get in touch with somebody who has facilitated this work. As Sarah pointed out in the last demonstration, again, another great way that our information is all being brought together. We can see indicators that are related to this program, other funding opportunities, reports available on our site. So just a great way to keep exploring this topic specifically. And then if you would like to continue on in this exploration of different diabetes related programs, you can see that it has also populated up here in the right-hand corner some related promising practices. So that's a little bit about our promising practices database. Again, if you are somebody who is in the programmatic space, I think that this would be a great tool for you to use and to share. I have used it as well. I'm currently working on my master's in public health, and this is something that I have even referenced for school assignments. So it has been a great tool for people at all different types of levels. The next resource I would like to point out is our COVID-19 resource. And this is something that we are keeping updated regularly. We know how important and valuable this information is, not only to those that are in the community health space, but to the general public as well. So we want to make sure that this information is readily available to anyone who visits our website. Here on the left, you'll see that we have some links to COVID-19 data. In the middle tab here, you'll see that we're featuring direct links to hospital systems and also community health centers who are doing some of that vaccine distribution. And then in the far right-hand column here, you'll see that we also have some direct links to the city and county public health departments. And then all the way down here, you'll see that we also have some links to the Ohio Department of Health's different dashboards. We have a nice interactive vaccine distribution dashboard available as well. Our next resource we are going to look at is our resource library. One of the other resources that I will mention briefly without visiting is our funding opportunities page. This is managed by our vendor, and this is updated regularly with national funding opportunities. And some of these other resources are very, very valuable, but we will invite you to explore those at your own leisure. So in visiting our resource library, we have a great deal of resources for those in community health, for those interested in population health, and we do have quite a bit of resources available here as well. So I will first point out our filter that we have available over here, and you can filter information in our resource library similarly to how you would filter it with the Promising Practices database. So you can see here that we do have a little over 100, almost 150 different resources available in our library. So you can use our filter to narrow down that. You can also use our search bar. So if you have a specific title of something that you're looking for, maybe a specific report, you can use the search bar. You'll see that we have our resources broken down and sorted into different types. So that can be an easy solution to looking for something specific as well. If you do have a resource that you think would be important and valuable to us to have in our resource library, we invite you to submit that here in this hyperlink. And then lastly, what I'll point out with our resource library is our collections title. So here we have different collections that we have pre-sorted. So especially if you're looking for something very quickly, very immediately, let's see, you know for sure that you're looking for information about health equity. This is a great way for you to access all the resources available in our resource library about health equity and so forth. So we do invite you to use that. We are always adding to the resource library, always adding new information, and we do think that this is a great resource for those in that space as well. We are going to go ahead and continue on. Please continue adding those questions to our chat, and I am going to go ahead and invite Sarah back to round out our data portion of the presentation.
Thanks, Libby. Again, bear with me all while I share my screen. Libby, can you confirm, are you seeing the PDF?
Correct, yep.
Okay, perfect. So thanks, Libby. And in This last section of our webinar today, I am going to cover another data-related tool on the site, and this is the option to create a custom report. So again, we've already covered how to search for data. We've looked at some of those specialty dashboards. You've seen how to create a custom dashboard. So now, again, I'm going to show you how to create a custom report on the site. So this tool is called the Location Report Builder, and it allows you to build customized reports based on indicators that you select and then a location of interest. And it's a nice way to, pretty quickly and easily pull together different components on the site, and you can download your report as a PDF. And I do want to point out that these custom reports are more of a snapshot in time. So the data would not be updated in these custom reports like it would be in a custom dashboard. So again, just to keep that in mind. But we do hope this tool is helpful to you. These reports can be used to help tell the story of your community. And it's nice because you can easily share them with others. So this is a sample custom report that I created, again, just to show you for example's sake. So again, we know that chronic disease was a priority area for Lake County. So I have selected just a few chronic disease related indicators for my report. And again, these are very customizable. You could, add as much text as you want. You can change titles, etc. So I just have a fairly generic title. I have adults 20 plus with diabetes, adults 20 plus who are obese, and then I also have the age-adjusted death rate due to coronary heart disease. So those are the 3 indicators that I have chosen to include in my report. And as you can see, there's various components that you can add. So up top here, I've got an indicator card, again, showing the current value for Lake County, as well as some of those comparisons. I've included some text just to describe what that indicator is, as well as I've listed the source of that data. Here you're going to see that change over time graph. And then this particular indicator has data available by gender. So I've included that bar graph here as well. And then I've tried to kind of keep my report consistent. So I've selected similar components for each of my 3 indicators. So again, that's a sample report that I created, and then I'm just going to open the site back up and talk you through how to do that at the site. So to get to the Location Report Builder, you'll go to Tools and Resources and then build a custom report. So as you see here, your first step is that you're going to have to select a location. So using the drop down, I'll just go ahead and select Lake County. Now that you've selected your location, you're going to see the toolbar is showing. So your second step would be to start adding indicators. So to do that in the toolbar, you would just click Indicators. And here you could type in all, and then literally all of the indicators that are available for Lake County would show, but I'm going to go ahead and just do a keyword search for diabetes. So now that I've done my keyword search, on the left here, you're going to see all of the indicators that the site is pulling in that are related to diabetes. So I'm going to go ahead and select adults 20 plus with diabetes. Then on the right, these are all of your various report components that you can add, and you can just hover over them to get a quick example to see what that would actually look like in your report. So you're going to now select the various components that you want to add. So I'll just select a couple here to show you what those will look like. And then once you're done making your selections, you'll just go ahead and click Add. And then you're going to see all of those components are in this report. And you're probably thinking, this looks not like the sample I showed you. And that's because I made, some modifications. So to the right over here, you're going to see there's an edit and preview mode. So while you're in edit mode, you can customize your report. So you can delete components if you're not happy with them by just clicking this orange colored X. You can adjust font by clicking, or text by clicking this pencil symbol. So you could, bold this, center it, etc. Type in your own text. You can also reorder components by clicking and dragging them to where you want them to go. You can resize components again by clicking and then dragging over. So again, you can make this really your own and make this finished product, however you want it to be. If you wanted to add additional indicators, at this point, you would just click Indicators and follow those same steps I showed you. Another nice thing you can do is you can add demographics data to your report. So over on the left, you're going to see these categories. And then at the right, again, are the various components you can add. You can also add socio-needs index data. You can insert a map of the location you picked. You could insert a legend. So say, for example, you were going to include an indicator card here. So the legend might be helpful to those who are reading your report just to interpret some of those colors and the icons and things. You can also add custom text blocks and then, you know, some of these horizontal or vertical lines if you want to use those to break up your content. Over to the right, if I click preview, you're going to see all my edit options go away just to give me a better sense of what my finished product is going to look like. When you're done with your report, you can save it just by clicking the save icon in the toolbar. So if I click save, you can download this report as a PDF, or for example, if you're not quite finished and you want to return to this report, you can actually save it to your web browser so long as you don't clear your cache by clicking temporarily save for later. So that is how to create a custom report on the site. I realize that we covered a lot of information today, but we hope you have a better sense of some of these tools that are available to you and the data that's available on the site. And if you're using it in the future, please don't hesitate to reach out to us with questions. We are more than happy to help. So I'm going to stop sharing my screen and I'm going to go ahead and turn things back over to Libby to wrap us up.
Thank you, Sarah. And as I am getting my slides ready again, we did have one question come in, and Sarah, maybe you can add some more context to this, but we did receive a great question asking, can you pull multiple indicators? The answer to that is yes. And then Sarah, would you mind taking a couple moments to maybe explain that a little more?
Sure. So if I'm understanding correctly, the question was, can you add multiple indicators to a report? Is that right, Libby?
Correct.
Yes,
Yep.
you absolutely can. So in the sample that I showed, I actually had 3 indicators in my report. So what I showed you live on the site, I was just adding one for example's sake, but if you want to add additional indicators in the toolbar, you would click indicators and then you could do, say, a keyword search for heart disease or obesity, whatever that might be. And then a new list of related indicators will show, and then you would select your report components that you're interested in. So you just follow that same step. So you start your report by selecting a location, then your toolbar shows, you click indicators, and then that's where you can keep going back to add as many indicators as you want.
Thank you. Thanks, Sarah. Yeah,
Sure.
that answers that question. So we are going to go ahead and round this out. This hour flew by, and we know that this was a lot of information. We are going to provide just a quick summary. A couple of things I do want to mention before we wrap up for the day. We do have a couple of great features in our website for how to go through some of these different steps. So under the Learn More tab on our page, you can visit the How To page, and that will take you to some of those documents that can help give you a step-by-step guide for building those reports and so forth. We also have a Contact Us page. Through this page, you will be able to send us a message, and this does come to our team directly. So feel free to utilize that. You will be receiving a follow-up email from myself, and so you can also contact us that way as well. So just wanted to make those few points before we wrapped up. We know that this is a lot of information, and these are some of those takeaways that we hope that you are able to walk away with today. So of course, our website serves as a great neutral data repository for that population health data with so many different indicators, which allows you to build custom dashboards, custom reports. Hopefully through some of those different walkthroughs, you were able to identify ways to utilize the different resources and promising practices available. And overall, we just hope that our partners are able to use this information as you continue on in those community health planning and community health improvement efforts. So the last thing that I will plug is that we are available for extended trainings. If you have a team of folks, or if you have a network of individuals who you think would benefit from a specific examination of different topics on our site, for example, if you want to look specifically at food insecurity or housing, we are certainly happy to provide you with a deep dive training. So you can feel free to contact our team today. So that rounds out our summary, and I'm going to go ahead and pull up our next slide, which does have our contact information on it. And as I'm doing that, I'm going to go ahead and look in our chat to see what some of those questions are. Okay, great. So thank you to those of you who have put in a couple of questions. One of the questions that we did receive is what's a quick way to get help or questions answered? Again, I would definitely say that contact us feature. We stay on top of those messages that come in because they do come directly to us. And of course, if there is a generic question or a common question that you think you might have, visiting that FAQ section of our page is a great way to answer some of those questions. And as another question that came in, there is not login information that is needed for our website. So you can just visit healthyneo.org and you will have access right away to all of those different indicators and the information that we looked at this morning. So I will give us a few more moments as we enter into the final few minutes of our webinar.
Hi, everyone. This is Patricia. I'm only hopping on quickly. Thank you so much for being with us today and all of your questions and comments. And again, it's Libby and Sarah. They did a great job. So, you know, we so much appreciate all of the work that is needed for this to be made possible. Again, if you have any questions, feel free to contact us. We're happy to help.
And I'm not seeing any more questions come in at this moment.
No, me neither.
So we'll leave it open for a few more moments before we go ahead and round out our training for today.
And if you did not see in the chat, we're slowly on social media. Most of our messages either come from us as personal ambassadors to this website or through our agencies, the Center for Health Affairs and Cuyahoga County Board of Health. We do use a hashtag HealthyNEO. So if you found something really interesting, give us a shout out as we're building our audience and helping our audience, you know, find us. So we appreciate any support and promotion that you're willing to give.
Thank you. Yes, definitely. If you are on social media, hashtag HealthyNEO is a great way to find us through there. We do have a question, Sarah. I'm wondering if you could answer this and provide some insight. How often is our data updated?
Sure, great question. So I would say for the most part, most indicators are updated on an annual basis, but again, it's just going to depend on where that specific data is coming from. As far as when it's available on the site, so as soon as our vendor receives the updated data from the actual primary source, they will have it up on the site within like 2 to 3 months, so like 60 to 90 days. And on the indicator detail page that I had showed, like when you click on an indicator name and you can see all of the specific information about it, that does have the option to select various measurement periods. So if you want to look at like a previous measurement period, you can do that. And keep in mind, like on the left where it said the data source, you know, it will say when it was last updated, just so you have a sense of that.
Thank you. And yes, that is a great question. And then, of course, you can certainly get in touch with us after today's webinar if you have any additional questions that you think of as you're visiting our site or as you're sitting and processing. I know sometimes those questions can come after the fact as well. So we are happy to answer any questions with the last few moments that we have remaining and also after the webinar as well. Okay. Well, if there are not any additional questions, I think we will go ahead and conclude this Lake County specific webinar. Sarah, Patricia, I invite you to make any last comments if you have any additional comments or things that you'd like to leave the group with. Okay. I think we are good. Well, thank you, everyone. We hope that you have a great day, and we look forward to continuing to work with you with this Healthy Northeast Ohio information. So thank you so much for joining us, and we hope you have a great day.